What's up, YouTube? It's Jennifer. It is Tuesday, November 22nd. I'm just going to make this video real quick because my videos should really serve as like a sounding board for those people who have constant obstacles when it comes to their surgery. Um, the past few months have just been like a roller coaster, and my last video, technically, even though I wasn't in it, which is probably a good thing, but my last video was basically telling you I've been approved, miraculously approved. Even the insurance department really didn't quite understand how, because they were adamant that I would not be, and I was insistent that they at least try to submit it. So they submitted it, and it was accepted within like 2 or 3 days. And then my surgery was scheduled, and I was supposed to go to my pre-op in the end of this month. And none of that's happening now. Surgery has been canceled. It's no longer December 12th. My work, I could tell the long story, but the short version is basically we're getting a new computer system at work that eventually will phase out my job completely. I will no longer have this job because of this computer system. But until then, we have to learn the computer system. Well, technically, it's like there's two different phases, phase 1 and then phase 2. Phase 1 is just going to help us do our job easier, I guess, but there's more information we have to put in to the system, which seems to me like it's going to make it harder. But then when phase 2 kicks in, then all the data entry for the Red Cross is completely eliminated. So, long story short, they're doing all the training for this program in December, and my surgery was December 12th. So they would not approve my medical leave. I submitted it to my boss. She submitted it to her boss. And then they also recommended that I submit it to Human Resources, and I submitted it to all 3 people, and all 3 people rejected it. So I have to wait until they said after February 1st I'm eligible. There's no more training or anything at work for me to do, so they said I should be fine, and I can attempt to take my medical leave then. The problem with that is that my insurance changes as of January 1st. I have Care First through Blue Cross Blue Shield right now. As of January 1st, I have Cigna, and Cigna's qualifications aren't exactly the same as Blue Cross Blue Shield. They're a little more picky, I guess you could say. But what I'm going to try to do is I'm going to ask them as soon as January 1st hits. I'm going to ask if they can, or the 2nd, if they could submit it to Cigna, along with the fact and include documentation that Blue Cross did approve me and I just had an insurance change. And hopefully all the documentation together will make them understand that it's medically necessary and I need this stupid surgery. And if that happens and they approve me quickly, then I'm just going to go ahead and I'm going to schedule my surgery for I kind of want to do it on Valentine's Day, which is really fucked up, I guess, but I don't know, who am I going to spend Valentine's Day with? Give me a break. So, it'd be kind of cool for that to be my surgery date, but we'll see. Other than that, life's been going. I don't know if I'm talking really loud or if I'm talking too softly because my ears are clogged. My right ear isn't as bad. I can hear 80% out of this ear. My left ear, however, I can hear maybe 10%, maybe 20, maybe, I don't know, something like that. So I really can't hear much at all out of this ear at all. And it's really annoying because I can hear myself talking in my head. And it's like, when you hear yourself on the voicemail or you hear yourself on an answering machine and you hate your voice. Yeah, I've got it in my head 24 hours a day now. So, besides that, just the sinus is acting up. And then I've had migraines for 4 days. And I had toothache and some jaw pain, and I went to the dentist on an emergency basis, and she said, well, you've got some cavities you need filled and an impacted wisdom tooth that you need pulled. But I've had that impacted wisdom tooth for 6 years. eventually I will get it pulled, but it typically doesn't cause a problem, like maybe once in a great while. So, and other than that, it's just been like scheduling so many health appointments because I just feel like I'm breaking down more every day. Next week, again, is a lot of medical appointments. So my sister's home. I'm going to go because my niece will probably want to be on the video. You want to be on the video? On the camera? Come here.
Hi.
Say hi.
Hi.
Okay. So what'd you do today? Oh, wet. Is it raining? Okay. Go take your shoes off. Say bye.
Bye.
Alright. And that's all I have to say. I will talk to you later. Bye.